This photo shows the major and minor tip support mechanisms. They are very important to memorize and understand because may come as a question in the OSCE station. So pay attention to them, please. This is very important slide. The ideal photographic views of rhinoplasty patient. The ideal views are frontal, lateral view, which include right and left lateral, oblique, which include right and left oblique, and basal views. In this photo, the question will be what is the deformity seen in this photo? The answer will be as follows. There is indistinct nasolabial angle. You can see A and compare it with B. And the nasolabial angle is indistinct in A while is prominent in B. Also, the other abnormality seen is over-projected nasal tip. What is the cause of this abnormality? Because there is prolongation of the caudal aspect of the quadrangular cartilage. As you can see in this photo, in first look you may think that the A is post-operative view and the B is the pre-op view, but unfortunately the reverse is true. A pre-op and B post-op. The patient, as you can see, the pre-operative view is much better and much nicer than the post-operative view. This is a bad result for rhinoplasty. The patient come to seeking for rhinoplasty in A. In B, the patient 6 months after surgery, that the photo demonstrate tiptosis, loss of tip projection. You may be asked what you can see. You will say there is tiptosis, loss of tip projection. What is the cause of this? Excessive sacrifice of the tip support mechanism. So as we said before, the tip support mechanism, minor and major tip support mechanism, very important to understand and memorize. So as you can understand the cases of different cases of rhinoplasty pre and post-operatively, and you can tell the type of deformity you can see in the photos. In this photo, you may be asked about the type of the deformity. As you can see in A, it's called polypeak deformity. Another question may be what causes the polypeak deformity? The answer will be inaccurate alignment or inadequate reduction of the cartilaginous pyramid. A represents the pre-op view and B represents the post-operative view. In this photo, you can see over-projected nasal tip. In A, and in B you can see lower lateral cartilage eccentricities. The examiner may ask you about the type of approach you will use for treating this type of deformity. You will say open approach rhinoplasty. In this photo you can see in A, incision used for open external approach rhinoplasty to the nasal tip. B, this is the exposure through an open approach. C, you may be asked about what type of deformity you see in this photo. The answer will be asymmetry of nasal tip, demonstrating convexity of left lateral crest and concavity of right lateral crest. The other view, which is D, it's a basal view. You may be asked about the type. What type of the view? You will say it's basal view. What type of approach is on open approach? What can you see or describe the deformity? Asymmetrical, twisted, and unequal lateral cartilage.